of the Minimal and Non-Invasive Treatment Society, and he is actually, I can say on behalf of myself and also my friend Professor Muhammad Hamid, that he is our mentor. Professor Zhang has more than 15 years experience in HIFO treatment, ultrasound guided. He's one of the founders actually in the technique all over the world, and he's done, I can reckon more than 9,000 cases. He's our tutor and he's our mentor actually, and he was supposed to be live now, but unfortunately he had to cut off. He just sent me, so he's going to give us a talk about clinical applications of HIFO, state of the art. It's a video presentation.
Ladies and gentlemen, good morning. It's my great honor to attend the first International Radiology Conference in Cairo. First, I would like to thank to Dr. Fawzi. Thank you for your invitation. High-intensity focused ultrasound is a non-invasive treatment modality. This slide shows how it works. This is a transducer. The ultrasound beams come from the surface of the transducer and focus at some distance away from the surface of the transducer. During the treatment, the ultrasound beams penetrate the human body and just focus at the target. When the temperature increased to over 65 degrees, the necrosis of the tumor occurred. From the monitoring image, we can see the grayscale changes like this. Here, we can see how it works. This is the liver, and the transducer moves and target at the lesion and start to solicate. We can see the grayscale changes like this. Then we solicate again, then move the transducer to this point and focus again. When the grayscale change area covered the whole tumor, the treatment terminated. So this technique was first proposed by Lian in 1940s. However, this technique didn't develop for a long time because there was low monitoring image at this time. So with the development of the diagnostic image, HIFO received the international attention again in 1988. Our group started this project after 10 years basic research. In 1997, this technique was first used in clinic to treat patients. Now there are two types HIFO system. One is the ultrasound guided HIFO from Chongqing, China. Another types MR guided HIFO from Sate and also from Philips. I have the experience using both MR guided HIFO and ultrasound guided HIFO, and I know that ultrasound guided HIFO has more advantages than MR guided HIFO. The most important, the treatment time is much shorter, and the indications MR guided HIFO was less, and ultrasound guided HIFO can be used to treat different types of solid tumors. First, I would like to share with you about HIFO treatment for liver cancer. So far, there are only the JC model of Chongqing from Chongqing HIFO can be used to treat the liver tumors. There are many ways can be used to treat liver cancer. HIFO play a key role in this field. For example, we can use this technique to treat the liver tumors in difficult locations. For example, like this case, like this liver metastasis from colon cancer. And the segment 1, there are no way to treat, use the traditional treatment. So we can use HIFO. This before HIFO treatment, the solictation time is 33 minutes. And you can see the treated area. So 1 day after HIFO treatment, the CT scan shows the treatment range was much larger than the tumor size. So 30 days after HIFO treatment, we can see the treated region was getting smaller. And here is 3 months, here is 8 months. The PET scan at 8 months shows there was low recurrence and in the whole liver. And here is 2 years, and here is 3 years. Yes, like this, we can use this technique to treat the patients for the curative treatment purpose. And also, for the other patients, the patients have low chance for surgery, for RFA or some other treatment choice. So this patient gets the embolization, like the taste first, but we can see the MRI shows there is a residual tumor over there. So we treat this patient with HIFO again. Here is before, you can see, here is after. So for this, we can also use this technique to treat the patients after TACE. So when we see the residual tumors, we can use HIFU to treat these patients again. For these patients, for sure, they can benefit from this HIFU combined with TACE. So here I just want to show you our group the treatment for small HCC from our group. Here, that's the baseline of the characteristics of these patients. So we can see for this group of patients, after HIFU treatment, the 5-year survival rate was over 70%. So what is comparable with surgery and RFA. For those patients, there was low chance for surgery and also for RFA. So like these patients, we HIFU offer them more options for them. So the treatment time actually is not so long. Like this case I just showed you, like we start from 2 p.m. Then you can see the gray scale changes before, like this, and here, like 10 minutes after that, we can see the gray scale changes like this. Here's 20 minutes, here's 30 minutes, and totally 35 minutes. Then the treatment was done. So like this case, the HCC, the tumor was 4 centimeters in diameter, was just adjacent to IVC. So this patient was treated with RFA first, but only ablate a small part of the lesion. We can see the residual tumor around this area. So we give this patient HIFU treatment. Here is a contrast ultrasound and shows the ablated area during the treatment. Then here's 1 day after that, the CT scan showed the tumor was completely ablated. There was no damage to the surrounding structures. Here's 1 month, and here's 3 months after that. The tumor was getting smaller. We can see the IVC, the portal vein was no damage, was fine. So this technique can be used to treat other indications like the pancreatic cancer. We all know that for the pancreatic cancer, when the diagnosis was made, most of them have low chance for surgery. Even for those have the chance for surgery, but its average survival time just 19 months after surgery. So for these patients, we should find another way to increase the survival time and also improve the quality of life. So here is from Bonn University. They started from this project in 2014. I was there, working with them together for 3 months. So here's the patient they treated, the totally 133 patients. And you can see most of them were stage 3 and stage 4, low chance for surgery. And even 5 patients were treated with HIFU because the recurrence after the Viper surgery. And also 41 patients was placed stent before HIFU treatment, and 13 patients had a second cessation of life. This is the treatment time. Around the treatment time, the room time is around 2 hours. So the solid catching time around 900 seconds. After treatment, we can see all patients had pain relieved after HIFU. No matter stage 3 and stage 4, all of them had the pain relieved after that. And also, the local tumor control was fine. All patients like this, the treated region, the tumor was shrink after HIFU treatment, no matter which stage, stage 4 and stage 3. They all had a tumor shrink after HIFU treatment. Here, the most important, we can see the survival time was 16.2 months after HIFU treatment, which was significantly longer than those patients without treatment with HIFU. Here is one case I just showed you. Actually, that's the first case we treated together in Bonn University. You can see here is the lesion. This total solidification time, just 700 seconds. So 1 day after HIFU treatment, MRI shows the treated region. There was low enhancement in the treated region. The surrounding structure was fine. So, and also here, the follow-up MRI at 6 months after that, we can see the shrinkage compared with 1 day after that. Here, 3 months after that, only like 8 millimeters in diameter in this area. There was low enhancement. Here is 1 year after that, disappeared. Also, we can see the tumor marker was decreased and to the normal level at 9 months after HIFU treatment and sustained for a long time. So here is another case, like this patient, 70 years old. First, HIFU was performed. Here's 1 day after that. So 3 months, we can see the shrinkage And at 6 months, we could also find the tumor was shrinked. But here, 15 months after that, recurrence occurred. So we treated the patient with HIFU again. Here's 1 day after the second session of HIFU treatment, we can see the treated region was large. So here, we can see the follow-up time at 6 months after the second session of HIFU treatment, the tumor shrank significantly. Also, the tumor marker was changed with the tumor size changes. So also, this technique was used for the treatment of bone tumors. For the primary malignant bone tumors, our results already published in Radiology. So, like the 5-year survival time is comparable with like sparing surgery. This is a case of osteosarcoma. 18 years old girl. Before treatment, we gave this patient chemotherapy. Then you can see the response was good. So then we give HIFU treatment just 1 session. You can see the tumor was completely ablated. Here's 1 year, 2 years, and 3 years. You can see the changes in the area. There was low incurrence, so which is very good for the patient with primary bone tumors. If they want to have the amputation, HIFU is a good choice. And also, I think like HIFU can be used to treat the bone metastasis. I even think it's better than radiotherapy. Like this case, this patient actually had the bone metastasis in the pelvis, no other choice. Then we treat with HIFU. You can see here's before, here's 1 month after that. Here is the CT scan before 1 month and 3 months after HIFU treatment was getting smaller and smaller. The most important, the pain relieved after HIFU treatment. This is another case. This patient had breast cancer and had the sternum metastasis. The pain score was 10 out of 10. So this patient also had a radiotherapy and also chemo, but it didn't work. So she came to the Department of Radiology and want to have HIFU treatment. So here is the real-time ultrasound image during the treatment. You can see we treat this one, use a line scan with a lower power, just very quick. So the treatment time was not so long. So you can see the grayscale changes like this. The PET scan before HIFU treatment, you can see here the glucose intake, and here is after that was selective. So the treatment was good. The most important, the pain relieved, even 1 day after that, from 10 points to 1 point. So this technique also uses other, like the uterine benign diseases. So in 2000, HIFU was first used to treat uterine fibroids. Later, use this technique to treat adenomyosis and also other diseases. So first, I just want to share with you about the uterine fibroids. This is from our university. Like 757 patients were treated. The lung perfused volume, the average, was over 80%. Here, after the treatment, we can see the symptoms improved. Here, the before HIFU treatment, the score, symptom severity score, was around 60 points. And 3 months after that, significantly decreased and sustained for 3 years. And also from this slide, we can see the shrinkage rate. It is 3 years, the shrinkage rate is around 90%. Like this one, we can see the multiple uterine fibroids. Here's before HIFU treatment, you can see the small uterine fibroids. 1 day after that, you can see multiple uterine fibroid was completely ablated, even the small one. Here, 4 months after that, we can see the treated uterine fibroids disappeared. Of course, the symptoms improved. And this technique also is a good choice for adenomyosis. So we use this technique to treat adenomyosis in 2007. And this technique can be used to selectively ablate the lesion to improve the symptoms. The first case we treated like this one, so we just use a 200 watts around, like the solidification time is around 9 minutes. So room time is 1 hour. The symptoms significantly improved after HIFU treatment. Now we have the experience with this. So for the adenomyosis, the different type, if they don't have the present desiring, then they don't want to have the baby, then we have the protocol for this kind of patient. If they want to have the baby in the future. So or the near future, we have to use this technique carefully to protect endometrium. So this, for example, here is the intrinsic, like this extrinsic, this is the intramural, and also this diffuse adenomyosis. We all have the protocol for that. For example, like this case, intrinsic adenomyosis, if they don't have the childbearing desire, then we can completely ablate the adenomyotic lesion. Like this one day after that, we treat this area. So 4 months after HIFU treatment, the MRI shows the treated region almost disappeared. Then the posterior wall of the uterus are getting normal. So for this one, if they don't have the desire for pregnancy in the future, we can treat like this. But for the extrinsic adenomyosis, we can selectively ablate the lesion like this and protect the serum and also the endometrium. Like for this intramural adenomyosis, like this one, so we also can selectively ablate the lesion. Here, the treated region. So without damage to the surrounding structures. So it's a good choice for these patients. Also, for the abdominal wall endometriosis like this, HIFU is non-invasive, and the treatment time is short without anesthesia, so can be easily ablated. The lesion can be easily ablated like this. And also, this technique can be used to the placenta accreta. It's easy to treat. Like this, you can see the grayscale changes like this. Here is a contrast ultrasound. So for this type of disease, it's also easy. And after treatment, even you don't have to do the dilation. So that's all I want to share with you. Thank you for your attention. Ladies and gentlemen, good morning. It's my great honor to attend the first international.
دكتور فوزي دكتور فوزي ممكن
اتفضل يا فندم.
I want to ask Dr. Zhang a question.
لا he's not live.
Not live?
Not live.
Okay.
He had to.
شكرا يا باشا. شكرا يا باشا.
Now I would like to introduce Dr. Hussein Yuin.